1. What is the primary characteristic of autism spectrum disorder, ASD? A. Lack of eye contact. B. Repetitive behaviors. C. Difficulty with social communication. D. Impaired mobility. Answer: C. Difficulty with social communication. Rationale: the primary characteristic of ASD is difficulty with social communication and interaction. While repetitive behaviors, B, and lack of eye contact, A, are common, they are secondary to social communication deficits in the diagnostic criteria. Impaired mobility, D, is not a hallmark of ASD. 2. Which of the following is considered a common early sign of autism spectrum disorder? A. Excessive talking and verbal skills. B. Delayed speech and language development. C. Strong interest in socializing with peers. D. High levels of motor coordination. Answer: B. Delayed speech and language development. Rationale: delayed speech and language development is a common early sign of ASD. Children with ASD may have difficulty with verbal communication or delay in speaking. Excessive talking, A. Strong interest in socializing, C. And high motor coordination, D. are not typical of ASD in early development. 3. What tool is commonly used for early screening of autism spectrum disorder in young children? A. Mini mental state examination, MMSE. B. Autism diagnostic observation schedule, ADOS. C. Beck depression inventory, BDI. D. Edinburgh postnatal depression scale, EPDS. Answer: B. Autism diagnostic observation schedule, ADOS. Rationale: the ADOS is a standardized diagnostic tool used for assessing autism spectrum disorders in individuals of all ages, and it is especially useful for early screening. The MMSE, A, and BDI, C, are used for cognitive and mood assessments, while the EPDS, D, is for postnatal depression. 4. Which of the following medications is commonly prescribed to manage irritability and aggression in children with autism spectrum disorder? A. Sertraline. B. Haloperidol. C. Risperidone. D. Diazepam. Answer: C. Risperidone. Rationale: risperidone, an atypical antipsychotic, is FDA approved for managing irritability and aggression in children with ASD. Sertraline, A, is an antidepressant, haloperidol, B, is an older antipsychotic, and diazepam, D, is a benzodiazepine, none of which are the first-line treatments for irritability or aggression in ASD. 5. What is the most common co-occurring condition seen in individuals with autism spectrum disorder? A. Schizophrenia. B. Down syndrome. C. Attention deficit/hyperactivity disorder, ADHD. D. Bipolar disorder. Answer: C. Attention deficit/hyperactivity disorder, ADHD. Rationale: ADHD is the most common co-occurring condition in individuals with ASD. Many children with ASD also exhibit symptoms of hyperactivity, inattention, and impulsivity. Schizophrenia, A, Down syndrome, B, and bipolar disorder, D, are not typically associated with ASD as commonly as ADHD. 6. What is a hallmark behavior observed in children with autism spectrum disorder? A. Frequent tantrums. B. Preference for routine and sameness. C. Increased interest in social interactions. D. Delayed physical growth. Answer: B. Preference for routine and sameness. Rationale: a strong preference for routine and resistance to change is a hallmark behavior of ASD. Frequent tantrums, A, may occur in various conditions. Increased interest in social interactions, C, is less typical, and delayed physical growth, D, is unrelated to ASD. 7. Which of the following is not part of the DSM-5 criteria for autism spectrum disorder? A. Deficits in social communication. B. Restricted, repetitive patterns of behavior. C. Intellectual disability. D. Symptoms present in early development. Answer: C. Intellectual disability. Rationale: while intellectual disability may co-occur with ASD, it is not a diagnostic criterion. The DSM-5 criteria include deficits in social communication, A, repetitive behaviors, B, and early developmental symptoms, D. 8. Which genetic disorder is most commonly associated with autism spectrum disorder? A. Turner syndrome. B. Fragile X syndrome. C. Down syndrome. D. Klinefelter syndrome. Answer: B. Fragile X syndrome. Rationale: Fragile X syndrome is the most common genetic disorder linked to ASD. Turner syndrome, A, Down syndrome, C, and Klinefelter syndrome, D, are associated with other developmental and chromosomal abnormalities, but not specifically with ASD. 9. What is the role of applied behavior analysis, ABA, in the treatment of autism spectrum disorder? A. To provide pharmacological therapy. B. To focus on developing motor skills. C. To improve social, communication, and learning skills. D. To diagnose co-occurring conditions. Answer: C. To improve social, communication, and learning skills. Rationale: ABA is a widely used evidence-based therapy that helps improve social, communication, and learning skills in individuals with ASD. It does not provide pharmacological therapy, A, focus on motor skills, B, or diagnose conditions, D. 10. Which prenatal risk factor is most strongly associated with autism spectrum disorder? A. Advanced maternal age. B. Lack of prenatal vitamins. C. Maternal infection during pregnancy. D. Low birth weight. Answer: C. Maternal infection during pregnancy. Rationale: Maternal infections during pregnancy are strongly linked to an increased risk of ASD. Advanced maternal age, A, lack of prenatal vitamins, B, and low birth weight, D, are associated risk factors, but less strongly than maternal infection. 11. What is the primary goal of early intervention programs for children with autism spectrum disorder? A. To cure the condition. B. To maximize the child's developmental potential. C. To ensure academic success. D. To eliminate repetitive behaviors. Answer: B. To maximize the child's developmental potential. Rationale: Early intervention programs aim to support developmental milestones and help children achieve their full potential. They do not cure ASD, A, or guarantee academic success, C. Eliminating repetitive behaviors, D, is not the primary goal. 12. Which co-occurring condition is most commonly observed in children with autism spectrum disorder? A. Anxiety disorders. B. Schizophrenia. C. Oppositional defiant disorder. D. Bipolar disorder. Answer: A. Anxiety disorders. Rationale: Anxiety disorders frequently co-occur in children with ASD, leading to heightened distress in social or unfamiliar situations. Schizophrenia, B, oppositional defiant disorder, C, and bipolar disorder, D, are less commonly associated. 13. At what age can reliable screening for autism spectrum disorder typically begin? A. 3 years old. B. 18 months old. C. 6 months old. D. 5 years old. Answer: B. 18 months old. Rationale: Screening for ASD can reliably begin at 18 months when developmental milestones can be evaluated. Screening at 6 months, C, or 5 years, D, may miss early signs, and 3 years, A, is too late for early intervention. 14. What is the purpose of the Modified Checklist for Autism in Toddlers, MCHAT? A. To confirm a diagnosis of ASD. B. To identify children at risk for ASD. C. To measure language proficiency. D. To assess intellectual ability. Answer: B. To identify children at risk for ASD. Rationale: The MCHAT is a screening tool designed to identify toddlers who may be at risk for ASD. It does not confirm a diagnosis, A, measure language proficiency, C, or assess intellectual ability, D. 15. Which of the following therapies focuses on teaching functional communication skills to children with ASD? A. Cognitive behavioral therapy. B. Speech therapy. C. Occupational therapy. D. Physical therapy. Answer: B. Speech therapy. Rationale: Speech therapy focuses on improving functional communication skills in children with ASD. Cognitive behavioral therapy, A, addresses anxiety and mood disorders. Occupational therapy, C, enhances daily living skills, and physical therapy, D, targets motor issues. 16. What is a common sensory processing issue in autism spectrum disorder? A. Hypersensitivity to loud sounds. B. Lack of sensitivity to pain. C's inability to differentiate colors. D. Difficulty with visual acuity. Answer. A. Hypersensitivity to loud sounds. Rationale. Many individuals with ASD experience hypersensitivity to sensory stimuli, such as loud sounds. Lack of sensitivity to pain, B, occurs less often, and color differentiation, C, or visual acuity, D, issues are unrelated. 17. Which type of repetitive behavior is commonly observed in autism spectrum disorder? A. Excessive hand flapping. B. Continuous verbal speech. C. Frequent falling while walking. D. Avoidance of food textures. Answer. A. Excessive hand flapping. Rationale. Repetitive behaviors like hand flapping are characteristic of ASD. Continuous speech, B, and frequent falling, C, are not typical, and food avoidance, D, relates more to sensory issues. 18. Which diagnostic tool is considered the gold standard for diagnosing autism spectrum disorder? A. Autism Spectrum Quotient, AQ. B. Autism Diagnostic Observation Schedule, ADOS. C. Childhood Autism Rating Scale, CARS. D. Vineland Adaptive Behavior Scales. Answer. B. Autism Diagnostic Observation Schedule, ADOS. Rationale. The ADOS is widely regarded as the gold standard for diagnosing ASD. The AQ, A, and CARS, C, are screening tools, and the Vineland scales, D, assess adaptive functioning, not specific to ASD. 19. Which behavioral therapy focuses on reinforcing desired behaviors in children with autism spectrum disorder? A. Cognitive behavioral therapy, CBT. B. Dialectical behavior therapy, DBT. C. Applied behavior analysis, ABA. D. Exposure therapy. Answer. C. Applied behavior analysis, ABA. Rationale. ABA focuses on positive reinforcement to teach and reinforce desired behaviors in children with ASD. CBT, A, addresses emotional regulation, DBT, B, targets emotional instability, and exposure therapy, D, treats phobias. 20. What is a key feature of restricted interests in autism spectrum disorder? A, interest in multiple activities. B, intense focus on a specific subject. C, easily shifting from one task to another. D, lack of interest in routines. Answer. B, intense focus on a specific subject. Rationale. Individuals with ASD often have restricted interests, characterized by intense focus on a specific subject. Interest in multiple activities, A, shifting tasks, C, or lack of routine interest, D, are less characteristic. 21. Which of the following is an early red flag for autism spectrum disorder in infants? A. Smiling at 6 months. B. Lack of babbling by 12 months. C. Crawling by 10 months. D. Responding to name by 9 months. Answer. B. Lack of babbling by 12 months. Rationale. Lack of babbling by 12 months is a common early red flag for ASD. Smiling, A, and crawling, C, are general milestones, and responding to name, D, is expected by 9 months. 22. Which neurotransmitter is often implicated in the pathophysiology of autism spectrum disorder? A. Serotonin. B. Dopamine. C. Acetylcholine. D. Norepinephrine. Answer. A. Serotonin. Rationale. Alterations in serotonin levels have been associated with ASD. Dopamine, B, acetylcholine, C, and norepinephrine, D, are less directly linked. 23. What is a key characteristic of social deficits in children with autism spectrum disorder? A. Its inability to recognize faces. B. Poor eye contact during interactions. C. Lack of gross motor skills. D. Difficulty in identifying colors. Answer. B. Poor eye contact during interactions. Rationale. Poor eye contact is a hallmark social deficit in ASD. Inability to recognize faces, A, may occur but is not specific, and C and D are unrelated. 24. Which intervention is most effective for enhancing communication in children with autism spectrum disorder? A. Pharmacotherapy. B. Group therapy. C. Picture exchange communication system, PECS. D. Meditation techniques. Answer: C. Picture exchange communication system, PECS. Rationale: PECS is a proven method for enhancing communication in children with ASD. Pharmacotherapy: A. Treats co-occurring conditions. Group therapy: B. Is not specific, and meditation, D. Lacks evidence for this purpose. 25. What is the typical age range for the first formal diagnosis of autism spectrum disorder? A. 6 months to 12 months. B. 12 months to 18 months. C. 18 months to 24 months. D. 2 years to 4 years. Answer: C. 18 months to 24 months. Rationale: the first reliable diagnosis of ASD typically occurs between 18 and 24 months when developmental delays become apparent. Diagnoses earlier, A, B, are challenging, and later, D, may delay intervention. 26. Which factor is most strongly associated with an increased risk of autism spectrum disorder? A. Childhood infections. B. Parental smoking. C. Advanced paternal age. D. Low maternal weight gain. Answer: C. Advanced paternal age. Rationale: advanced paternal age is a well-established risk factor for ASD. Childhood infections, A, smoking, B, and maternal weight gain, D, have weaker associations. 27. What is the primary focus of sensory integration therapy in autism spectrum disorder? A. Improving verbal skills. B. Reducing maladaptive behaviors. C. Enhancing sensory processing abilities. D. Increasing academic performance. Answer: C. Enhancing sensory processing abilities. Rationale: sensory integration therapy aims to help individuals with ASD better process sensory input. It does not directly address verbal skills, A, behaviors, B, or academics, D. 28. Which of the following is a common communication deficit in autism spectrum disorder? A. Echolalia. B. Rapid speech. C. Frequent interruptions. D. Excessive storytelling. Answer: A. Echolalia. Rationale: echolalia, the repetition of words or phrases, is a common communication deficit in ASD. Rapid speech, B, interruptions, C, and storytelling, D, are not typical features. 29. What is the primary purpose of an individualized education program, IEP, for children with autism spectrum disorder? A. To provide a standard curriculum. B. To address specific developmental needs. C. To enroll in special education classes only. D. To determine eligibility for funding. Answer: B. To address specific developmental needs. Rationale: an IEP is tailored to the individual needs of children with ASD, focusing on developmental and educational goals. It is not limited to special education, C, or funding, D. 30. Which environmental factor has been linked to an increased risk of autism spectrum disorder? A. Air pollution. B. High-altitude living. C. Low light exposure. D. Excessive screen time. Answer: A. Air pollution. Rationale: studies suggest a potential link between prenatal exposure to air pollution and an increased risk of ASD. The other options lack significant evidence. 31. Which of the following behaviors is characteristic of restricted, repetitive patterns in autism spectrum disorder? A. Frequent use of imaginative play. B. Obsession with a specific topic or object. C. Engaging in group activities. D. Easily adapting to changes in routine. Answer: B. Obsession with a specific topic or object. Rationale: restricted and repetitive behaviors often include intense focus on specific topics or objects. Imaginative play, A, and adaptability, D, are usually limited in ASD. 32. Which tool is commonly used for early screening of autism spectrum disorder? A and MMSE, Mini Mental State Examination. B. PHQ-9, Patient Health Questionnaire. C. MCHAT, Modified Checklist for Autism in Toddlers. D. MoCA, Montreal Cognitive Assessment. Answer: C. MCHAT, Modified Checklist for Autism in Toddlers. Rationale: MCHAT is widely used to screen for autism in toddlers. MMSE, A, and MoCA, D, assess cognitive impairment, and PHQ, 9, B, screens for depression. 33. Which therapeutic approach is based on the principles of reinforcement and behavior modification in autism spectrum disorder? A. Occupational therapy. B. Applied behavior analysis, ABA. C. Cognitive behavioral therapy, CBT. D. Play therapy. Answer: B. Applied behavior analysis, ABA. Rationale: ABA focuses on reinforcement to improve behaviors in ASD. Occupational therapy, A, targets functional skills, CBT, C, addresses thought patterns, and play therapy, D, enhances social and emotional skills. 34. What is a hallmark feature of social communication deficits in children with autism spectrum disorder? A, using gestures excessively. B, difficulty understanding nonverbal cues. C, speaking in complete sentences early. D, engaging in frequent social conversations. Answer: B, difficulty understanding nonverbal cues. Rationale: children with ASD often struggle to interpret nonverbal cues like facial expressions. The other options are not typical features of ASD. 35. Which co-occurring condition is most commonly associated with autism spectrum disorder? A, hypertension. B, anxiety disorders. C, chronic pain. D, cardiovascular disease. Answer: B, anxiety disorders. Rationale: anxiety disorders frequently co-occur with ASD. Hypertension, A, chronic pain, C, and cardiovascular disease, D, are not directly linked. 36. Which dietary strategy has been suggested for managing symptoms in some children with autism spectrum disorder? A, gluten-free, casein-free diet. B, high-protein diet. C, low-carbohydrate diet. D, Mediterranean diet. Answer: A, gluten-free, casein-free diet. Rationale: some families report symptom improvements with a gluten-free, casein-free diet, though evidence is mixed. Other diets, B, C, D, lack specific support for ASD management. 37. Which genetic condition is associated with an increased risk of autism spectrum disorder? A, Down syndrome. B, Fragile X syndrome. C, sickle cell anemia. D, Marfan syndrome. Answer: B, Fragile X syndrome. Rationale: Fragile X syndrome is strongly associated with ASD. Down syndrome, A, may have overlapping symptoms, but C and D are unrelated. 38. Which is the most appropriate method to support a nonverbal child with autism spectrum disorder in communicating? A, speech therapy only. B, picture-based communication tools. C, written language tasks. D, limiting communication demands. Answer: B, picture-based communication tools. Rationale: picture-based tools like PECs are effective for nonverbal communication in ASD. Speech therapy alone, A, may not suffice, and D, is counterproductive. 39. What is the role of occupational therapy in managing autism spectrum disorder? A, reducing repetitive behaviors. B, improving motor skills and daily living activities. C, treating co-occurring depression. D, enhancing academic performance. Answer: B, improving motor skills and daily living activities. Rationale: occupational therapy focuses on functional skills and activities of daily living. It does not primarily target behaviors, A, or mood disorders, C. 40. Which prenatal factor is a known risk for autism spectrum disorder? A, high maternal intake of omega-3 fatty acids. B, gestational diabetes. C, frequent prenatal exercise. D, vegetarian diet during pregnancy. Answer: B, gestational diabetes. Rationale: gestational diabetes has been linked to a higher risk of ASD. Omega-3 intake, A, and exercise, C, are generally beneficial, and a vegetarian diet, D, lacks evidence. 41. How does early intervention impact children with autism spectrum disorder? A, it cures ASD. B, it improves outcomes by addressing developmental delays. C. It replaces the need for ongoing therapy. D. It prevents co-occurring conditions. Answer: B. It improves outcomes by addressing developmental delays. Rationale: early intervention helps children develop essential skills and improve overall outcomes. ASD cannot be cured. A. And ongoing therapy may still be required. C. 42. What is the most common reason for aggressive behavior in children with autism spectrum disorder? A. Misunderstanding social norms. B. Hunger. C. Difficulty communicating needs. D. Hyperactivity. Answer: C. Difficulty communicating needs. Rationale: aggression often stems from frustration due to communication barriers. Social norms, A, and hyperactivity, D, are less likely primary causes. 43. Which of the following is a core diagnostic criterion for autism spectrum disorder according to the DSM-5? A. Impaired motor coordination. B. Deficits in social communication and interaction. C. Poor academic performance. D. Delayed physical growth. Answer: B. Deficits in social communication and interaction. Rationale: the DSM-5 identifies social communication deficits as a core feature of ASD. The other options, A, C, D, are not diagnostic criteria. 44. Which intervention is most appropriate for managing sensory processing difficulties in children with autism spectrum disorder? A. Sensory integration therapy. B. Group counseling. C. Cognitive behavioral therapy. D. Medication for hyperactivity. Answer: A. Sensory integration therapy. Rationale: sensory integration therapy helps children with sensory challenges. Group counseling, B, and CBT, C, do not directly address sensory issues. 45. At what age can autism spectrum disorder typically be reliably diagnosed? A. 6 months. B. 12 months. C. 2 years. D. 5 years. Answer: C. 2 years. Rationale: ASD can be reliably diagnosed around 2 years of age, though signs may appear earlier. Diagnosis at 6 months, A, or 12 months, B, is less common. 46. What is the primary goal of early intervention programs for autism spectrum disorder? A. To cure autism. B. To enhance developmental skills and independence. C. To eliminate repetitive behaviors. D. To delay diagnosis. Answer: B. To enhance developmental skills and independence. Rationale: early intervention aims to develop skills and improve independence. Autism cannot be cured. A. And delaying diagnosis, D, is not beneficial. 47. Which of the following medications is commonly used to manage irritability in children with autism spectrum disorder? A. Risperidone. B. Fluoxetine. C. Methylphenidate. D. Lorazepam. Answer: A. Risperidone. Rationale: risperidone is FDA approved for managing irritability in children with ASD. Fluoxetine, B, treats anxiety or depression, and methylphenidate, C, is used for ADHD. 48. What is echolalia, a common symptom in autism spectrum disorder? A. Repeating others' words or phrases. B. Lack of speech development. C. Speaking in complete sentences. D. Frequent stuttering. Answer: A. Repeating others' words or phrases. Rationale: echolalia involves repeating others' words and is common in ASD. The other options, B, C, D, do not describe echolalia. 49. What is a potential complication of untreated autism spectrum disorder? A. Enhanced social skills. B. Increased risk of social isolation. C. Faster cognitive development. D. Reduced sensory sensitivities. Answer: B. Increased risk of social isolation. Rationale: untreated ASD may lead to social isolation. Enhanced social skills, A, and reduced sensory sensitivities, D, are unlikely without intervention. 50. Which statement best describes restricted and repetitive behaviors in autism spectrum disorder? A. They involve frequent imaginative play. B. They are always harmful. C. They may include repetitive movements or routines. D. They are easily managed with medication. Answer: C. They may include repetitive movements or routines. Rationale: repetitive behaviors are hallmark features of ASD and include movements or strict routines. Medication D is not always effective for this. 51, which is an example of a strength often observed in individuals with autism spectrum disorder. A. Difficulty with all communication. B. Enhanced attention to detail. C. Poor memory for facts. D. Limited ability to focus. Answer: B. Enhanced attention to detail. Rationale: individuals with ASD often excel in attention to detail, while poor communication, A, and focus, D, are challenges, not strengths. 52. What does the term scripting refer to in autism spectrum disorder? A. Writing a story for a class. B. Repeating lines from movies or TV shows. C. Organizing a daily schedule. D. Writing repetitive notes. Answer: B. Repeating lines from movies or TV shows. Rationale: scripting involves repeating scripted phrases from media, often for comfort. Writing, A, C, D, is unrelated. 53. Which communication approach is beneficial for nonverbal children with autism spectrum disorder? A. Total communication. B. Limiting verbal interactions. C. Using gestures only. D. Teaching complex grammar. Answer: A. Total communication. Rationale: total communication combines gestures, visuals, and speech to enhance communication in nonverbal children. Limiting verbal interactions, B, is counterproductive. 54. What does the term joint attention mean in the context of autism spectrum disorder? A. Focusing on a task independently. B. Coordinating attention with another person to share an experience. C. Avoiding eye contact during interactions. D. Focusing on multiple tasks at once. Answer: B. Coordinating attention with another person to share an experience. Rationale: joint attention refers to sharing focus with others, a common challenge in ASD. Avoiding eye contact, C, is a symptom, not joint attention. 55. What is the most effective way to encourage social interaction in children with autism spectrum disorder? A. Punishing lack of interaction. B. Encouraging structured peer play. C. Limiting group activities. D. Avoiding challenging social situations. Answer: B. Encouraging structured peer play. Rationale: structured peer play builds social skills in children with ASD. Punishment, A, or avoidance, D, is counterproductive. 56. Which screening tool is commonly used for early identification of autism spectrum disorder? A. Vanderbilt Assessment Scale. B. MCHAT, Modified Checklist for Autism in Toddlers. C. GAD-7. D. PHQ-9. Answer: B. MCHAT, Modified Checklist for Autism in Toddlers. Rationale: the MCHAT is a widely used screening tool for early identification of ASD. Vanderbilt is for ADHD, GAD-7 is for anxiety, and PHQ-9 is for depression. 57. Which is an example of a repetitive behavior in autism spectrum disorder? A. Playing different games every day. B. Spinning objects for long periods. C. Engaging in flexible routines. D. Following varied daily schedules. Answer: B. Spinning objects for long periods. Rationale: spinning objects is a common repetitive behavior in ASD. Flexible routines, C, are less characteristic of ASD. 58. What is the purpose of applied behavior analysis, ABA, in managing autism spectrum disorder? A. To promote positive behaviors and reduce problematic ones. B. To focus solely on academic improvement. C. To eliminate sensory sensitivities. D. To replace therapy with medication. Answer: A. To promote positive behaviors and reduce problematic ones. Rationale: ABA aims to reinforce positive behaviors. It is not solely academic, B, or sensory-focused, C. Medication, D, is not a substitute. 59. Which of the following is a hallmark feature of autism spectrum disorder? A. Poor visual acuity. B. Deficits in nonverbal communication. C. Persistent low-grade fever. D. Frequent headaches. Answer: B. Deficits in nonverbal communication. Rationale: Deficits in nonverbal communication are core features of ASD. The other options, A, C, D, are unrelated to ASD. 60. What role does genetics play in autism spectrum disorder? A. Genetics has no role in ASD. B. ASD has a strong genetic basis with potential environmental contributions. C. Genetics is the sole cause of ASD. D. Genetics only affects language delay. Answer. B. ASD has a strong genetic basis with potential environmental contributions. Rationale. Studies show a strong genetic basis, with environmental factors also contributing. Genetics alone, C, does not account for all cases. 61. What is a common co-occurring condition in individuals with autism spectrum disorder? A. Osteoporosis. B. ADHD. C. Hypertension. D. Diabetes. Answer. B. ADHD. Rationale. ADHD is commonly co-occurring with ASD. Osteoporosis, A, hypertension, C, and diabetes, D, are unrelated. 62. What is the significance of early diagnosis in autism spectrum disorder? A, it prevents lifelong challenges. B, it allows early intervention to improve outcomes. C, it eliminates all symptoms of ASD. D, it delays developmental progress. Answer. B, it allows early intervention to improve outcomes. Rationale. Early diagnosis enables timely intervention, which improves outcomes. It does not eliminate C or delay progress D. 63. Which therapy focuses on enhancing social skills in children with autism spectrum disorder? A. Speech therapy. B. Occupational therapy. C. Social skills training. D. Physical therapy. Answer. C. Social skills training. Rationale. Social skills training specifically targets improving interactions and relationships. Speech therapy A focuses on language skills. 64. Which of the following is an environmental risk factor for autism spectrum disorder? A. Advanced parental age. B. Regular physical activity. C. Adequate prenatal nutrition. D. Frequent social interactions. Answer. A. Advanced parental age. Rationale. Advanced parental age is linked to increased ASD risk. Prenatal nutrition, C, and social interactions, D, are protective factors. 65. What does the term neurodiversity emphasize in the context of autism spectrum disorder? A. A medical cure for ASD. B. Individual differences in brain functioning. C. Eliminating repetitive behaviors. D. Avoiding specialized support. Answer. B. Individual differences in brain functioning. Rationale. Neurodiversity highlights unique brain functioning and strengths. It does not advocate for cure, A, or avoiding support, D. 66. Which of the following can improve communication in nonverbal children with autism spectrum disorder? A. Picture exchange communication system, PECS. B. Avoiding communication aids. C. Limiting interaction to verbal cues. D. Ignoring communication challenges. Answer. 8. Picture exchange communication system, PECS. Rationale. PECS helps nonverbal children communicate effectively. Limiting interaction, C, or ignoring challenges, D, hinders progress. 67. What is one of the earliest signs of autism spectrum disorder in infants? A. Frequent smiling at others. B. Lack of response to their name by 12 months. C. Advanced language skills. D. High levels of physical activity. Answer. B. Lack of response to their name by 12 months. Rationale. Not responding to their name by 12 months is an early sign. Frequent smiling, A, or advanced language, C, are less characteristic. 68. What is the primary focus of occupational therapy for individuals with autism spectrum disorder? A. Addressing sensory and motor challenges to enhance daily living skills. B. Managing medication regimens. C. Improving only social interactions. D. Teaching academic subjects. Answer. A. Addressing sensory and motor challenges to enhance daily living skills. Rationale. Occupational therapy targets sensory and motor skills for daily living. Social interactions, C, and academics, D, are secondary. 69. Which type of play is often delayed in children with autism spectrum disorder? A. Solitary play. B. Cooperative play. C. Sensor-motor play. D. Pretend play. Answer: D. Pretend play. Rationale: pretend play, requiring imagination, is often delayed. Solitary play, A, is more common. Cooperative play, B, is also challenging. 70. What is the primary diagnostic manual used to identify autism spectrum disorder? A. ICD-10. B. DSM-5. C. WHO guidelines. D. APA manual. Answer: B. DSM-5. Rationale: the DSM-5 is the primary manual for diagnosing ASD, outlining its specific criteria. ICD-10-A provides codes but less detailed criteria. 71. Which of the following is a hallmark of autism spectrum disorder? A. Frequent changes in interests. B. Persistent deficits in social interaction and communication. C. Rapid developmental milestones. D. High tolerance for sensory input. Answer: B. Persistent deficits in social interaction and communication. Rationale: social and communication deficits are core to ASD. Frequent interest changes, A, and rapid milestones, C, are not characteristic. 72. What is a common sensory processing issue in individuals with autism spectrum disorder? A. Inability to taste foods. B. Hypersensitivity to sounds. C. Frequent memory loss. D. Loss of balance. Answer: B. Hypersensitivity to sounds. Rationale: hypersensitivity to sensory stimuli, such as sounds, is common in ASD. Inability to taste, A, and memory loss, C, are unrelated. 73. What is a recommended intervention for improving social skills in children with autism spectrum disorder? A. Cognitive behavioral therapy. B. Group therapy focusing on social interactions. C. Avoiding peer interactions. D. Independent study programs. Answer: B. Group therapy focusing on social interactions. Rationale: group therapy helps develop social skills in a structured setting. Avoiding interactions, C, hinders progress. 74. Which neurotransmitter has been implicated in the pathophysiology of autism spectrum disorder? A. Serotonin. B. Acetylcholine. C. Dopamine. D. Glutamate. Answer: A. Serotonin. Rationale: abnormal serotonin levels are implicated in ASD. Dopamine, C, and acetylcholine, B, are more related to other conditions. 75. What is an effective early intervention strategy for autism spectrum disorder? A. Strict disciplinary measures. B. Structured teaching programs like TACCH. C. Delaying therapy until adolescence. D. Avoiding therapy to promote independence. Answer: B. Structured teaching programs like TACCH. Rationale: early interventions like TACCH improve outcomes by targeting specific developmental needs. 76. What is a characteristic of restricted interests in autism spectrum disorder? A. Broad interests in varied subjects. B. Intense focus on a specific topic. C. Rapid switching between hobbies. D. Lack of any interests. Answer: B. Intense focus on a specific topic. Rationale: restricted interests often manifest as an intense, singular focus. Broad interests, A, and rapid switching, C, are not typical. 77. Which type of therapy helps address sensory sensitivities in autism spectrum disorder? A. Occupational therapy. B. Cognitive therapy. C. Physical therapy. D. Speech therapy. Answer: A. Occupational therapy. Rationale: occupational therapy targets sensory and motor challenges. Cognitive therapy, B, focuses on thoughts and emotions. 78. What is the most effective approach for teaching communication to nonverbal children with autism spectrum disorder? A. Only verbal instructions. B. Use of visual aids and gestures. C. Ignoring communication difficulties. D. Sole reliance on speech therapy. Answer: B. Use of visual aids and gestures. Rationale: visual aids and gestures help nonverbal children develop communication skills. Verbal-only A methods are often less effective. 79, which is a common comorbidity in autism spectrum disorder? A. Schizophrenia. B. Intellectual disability. C. Crohn's disease. D. Chronic pain. Answer: B. Intellectual disability. Rationale: intellectual disability commonly co-occurs with ASD. Schizophrenia, A, and Crohn's, C, are unrelated. 80. What type of medication is commonly prescribed to manage irritability in autism spectrum disorder? A. Stimulants. B. Antipsychotics like risperidone. C. Antibiotics. D. Antihistamines. Answer: B. Antipsychotics like risperidone. Rationale: antipsychotics like risperidone help manage irritability. Stimulants, A, are used for ADHD, not ASD.